HIV remains a serious public health concern in the U.S., with over 1.2 million people living with the virus and around 35,000 new diagnoses each year. While HIV is both preventable and treatable, stigma, along with ongoing social and structural barriers to testing and care, continues to pose serious challenges.
Some of the key challenges that people are facing accessing HIV treatment and care, the first is stigma and discrimination. People who are living with HIV have difficulty coming into the clinics because they may face stigma in the workplace. There's also stigma in the community that can affect it. The second one I would say is access to care. There are some communities where care isn't available, and if care is available, sometimes the person is not able to access it because they can't even afford it or they don't have the transportation to get there.
My experience with me being first diagnosed with HIV, my father had died. I had to drop out of an art school that I was attending because I couldn't afford it anymore. Then testing positive for the HIV diagnosis. I was so uneducated about it at the time, I told the physician that I wanted to commit suicide. It was just too much to handle. Like, when is the appropriate time to discuss this with somebody? I literally felt like I was alone.
When I was first diagnosed, my mom had just died, so I was homeless. I was sleeping in my car. In the Black community, there's a lot of misinformation. It was just like, if you're gay, you'll get AIDS and die.
HIV continues to disproportionately impact marginalized communities, where systemic barriers, stigma, and lack of access to care remain persistent issues. These challenges are further intensified by anti-LGBTQ+ legislation and cuts to public health infrastructure, which undermine prevention and treatment efforts.
Some of the challenges that Vivent Health faces is finding publicly available funding, and that includes coverage for people living with HIV, as well as funding for prevention and reaching those out of care and testing so that everyone knows their status. All of this is made more complicated by anti-LGBT, anti-science, and a lack of coverage for individuals using Medicaid or Medicare, which make it very hard for people to access the services they need.
We have highly effective treatments, and our patients living with HIV can live long and healthy lives, but they have to take medication and stay on treatment, and that can be challenging. We know that HIV disproportionately affects some of our most vulnerable in our society, and these are folks who are dealing with not just HIV, but also structural and social barriers like food insecurity or housing instability or stigma and discrimination. And so we have to address those issues if we want our folks to be able to get in care, stay in care, and live long, healthy lives.
It is possible to end the HIV epidemic. Testing is the key. Every person that's living with HIV needs to know their status. And once you know your status, you can take action. If you're negative, you can do things that can prevent you from getting infected. If you're positive, you can get into the comprehensive program that provides individualized therapy, and you can actually become virally suppressed. And if you're virally suppressed and are able to maintain that, you are not able to transmit the disease. And that is what we call U equals U. Undetectable equals untransmissible.
Ending the HIV epidemic is within reach, but it requires collective action, sustained investment, and a commitment to equity and compassion. With continued effort, innovation, and will, a future without HIV is possible. For over 40 years, Vivent Health has been deeply committed to addressing HIV through advocacy, prevention, and compassionate, high-quality care. Their approach integrates critical social services and a safe, judgment-free environment that supports the dignity and well-being of every person they serve.
Vivent Health's mission is to end the HIV epidemic by providing integrated, personalized, judgment-free healthcare and social services, and to end HIV transmission through enacting effective prevention strategies. We provide clinical services, including medical, primary care, behavioral and mental health services, dental care, and pharmacy. Those clinical services are integrated with our social and structural care. That includes addressing food through food pantry and nutritional assistance, through housing, and through case management, which ties everything together so that our teams can make sure people live long, healthy lives.
We really believe in a person-centered approach. This means meeting a patient where they're at and understanding their needs. We work as a team, working with the clinical staff, the healthcare provider, the pharmacy, case management, all together to help meet the patient needs. And this has really led to excellent outcomes, having high viral suppression rates and getting the care the patient needs.
Vivent Health takes a unique, integrated, person-centered approach to HIV care and prevention, one that focuses on addressing broader inequities and removing the barriers that stand between people and the services they need.
When you come to Vivent Health, you're not just seeing one person. The whole staff here is just so fabulous. I love it so much. Right away, people were so caring. I didn't feel ashamed. I felt like I could take on the world.
What I would like people to know about HIV is this isn't a death sentence. You can still love yourself and be loved by other people, and you can still live a healthy life being HIV positive.
Vivent Health has done a wonderful job getting people who are HIV infected virally suppressed. They have viral suppression rates that are in the 90s. What that means is that there's very little transmission that's occurring. Combine that with the work that they're doing in prevention, I can envision this community could be free of HIV if things continue on that same trajectory.
We want everyone to know that the end to the HIV epidemic is in sight, but we can't give up. There's a lot of work to do.
Vivent Health champions a compassionate, patient-centered approach, uniting communities and providing expert care in the ongoing pursuit of a world without HIV and AIDS. To learn more, visit viventhealth.org today.